So normal heart rate is 110 to 160. Sometimes sources will say 120, 110 to 160 or 120 to 160. Um, so I do that first. I feel like it's the most important information. So I usually do my measurements and my vital signs if the baby's quiet. So I know that people are like, you can do it right with the baby in the mother's arms. If I have a choice, I'm not going to do that. I'm quicker and I can see better and I can function better with the baby not in the mother's arms. And so it really depends on your philosophy. You know, if you want to do as much of it as you can with the mother holding the baby, then so be it. But I'm a student and I do it the way that my preceptor says. But when I get my own practice, I'm going to ask them to give me the baby and I'm going to take care of my vital signs, my assessment, and then hand the baby back. It's just complicated. And there's, you know, if I get proficient at this, it can't take longer than 10 minutes. So, anyway, that's my philosophy on that. I just don't see, why we should, put ourselves in that situation. Um, so anyway, we're going to do a head to toe. So I'm going to look for molding, which is normal. And we just want to look if it's abnormal molding. All right. But we're going to see some overwriting skull bones. You'll feel ridges there. Reassure the mother it will resolve in a couple of days. Sometimes because of the molding, the head circumference is not accurate. And so a lot of times people will even wait to do the head circumference. There's two soft spots, fontanelles, we call them. You know, I don't mind in front of the mother saying soft spots. I don't always use medical terms in front of them because they don't know. And so these are at the junction of the skull bones, and they're there because the baby's going to grow, right? Their brain is going to grow and it needs space. So we're going to feel them, and they should be soft and flat. In the back one is is open a little bit sometimes. That one should be soft, flat, or closed. My understanding it isn't closed, but I worked with a preceptor who all the babies were closed, and if I said I could feel that it was open, they would say that you might think it is, but so anyway, that's my feeling there. It should be soft and flat. The anterior one up here should close in 18 months, and the posterior one will close in like 8 to 12 weeks. Okay, it's normal if you feel that front